We're here today at Refined MD, and we're going to talk about a special peel offered at the practice known as the Cosmelan Peel. I am here with the experts, so I wanted to ask some questions, like burning questions on our patients' minds. Tell me, what is this peel for?
So the Cosmelan Peel is actually a really unique peel in that it's really great for pigmentation. I know there's a lot of different chemical peels out there and a lot of different options, but in my experience, this has been one of the, if not the most effective peel I've seen for different types of pigmentation.
Oh, okay. Now, did you bring a kit with you that we could share with the viewers?
Yes, we have one right here. So
Okay.
there's kind of two components to it. There's a component that we apply in the office and then one that the patient would take home with them. This little blue bottle you just picked up is the oil removing solution. So we apply that in the office. It's very gentle. You don't really feel any discomfort with it, but that's just to cleanse the skin, remove any oils, and preparing for the peel itself. And in this little jar is the peel itself. It's called the Cosmelan 1. We apply it in the office, and then you go home, you wash it off, and then there's instructions on home care. And this is part of your home care system.
So this is what would go home with a typical
Yes,
patient?
with the patient. And then there's instructions here with just like little figures that tell you when and how often to use something. But you can see people will use it for a few months even after the peel to continue seeing benefit and improvement. And in here it's the Cosmelan 2, which also helps continue the skin lightening process. A little recovery balm to soothe the skin called Melon Recovery, and a good broad spectrum sunblock here.
So it looks complicated, but
It's pretty simple, and so I mean we can go through the whole kind of post-care process also after we go through the application and everything as well. Yeah.
So again, the ideal patient is somebody who's pigment challenged, would you say?
Yeah, so there's different types of pigmentation, and this can address a lot of different types. There's a type we call a post-inflammatory hyperpigmentation, or PIH for short, and this can range from anything from acne marks that you have, a mark from a rash or from scratching that are left over, or just anything that kind of irritates the skin. We tend to see this in patients who tend to make more pigment, so with darker skin types. And then other types of pigmentation are just spots from sun exposure, like lentigines, or just the freckles that you normally have. And this is also a good peel to address that. And one of the most challenging pigmentation issues we come across is melasma, which is a hormonally driven pigmentation on the face, often on the cheeks, the forehead. And this is really frustrating, I think, as a patient and a provider, because obviously we want to find good treatments to give the patient the best results possible, but sometimes what we had to offer was very variable, even things can make it worse. And I've found that the Cosmelan Peel really can help address the melasma as well. And I think that's what I primarily use it for in my practice, because a lot of patients come in very frustrated with all the different over-the-counter things they've tried, and even expensive in-office treatments. And this has really been a game changer, I think, for me as well as the patients. Yeah.
So you told me a lot, like good patients or patients that are good any that you just rule out and say you probably shouldn't be trying this peel?
So I mean, the other thing I should add for good patients is that this is a peel that's safe in all skin types, from light skin to dark skin. As for people who aren't great candidates, there aren't really many. I mean, it's not approved in like pregnancy, breastfeeding, and things like that. I wouldn't do it if you've recently had Accutane in the past couple months or so. And also if you're a picker, I would not do chemical peels unless you're really able to, resist from picking, or if you're not going to be compliant and avoid the sun after the peel, because that can cause additional pigmentation and worsening. So those would be more factors to take into consideration. But for the most part, it's good in all skin types.
So I'm really looking forward to seeing what the application process looks like.
Yeah, so the application process is actually really easy. I have a clip that I brought to share with everybody.
So that was really interesting. Glad you had the ability to kind of share that, because that answered a lot of my questions. Just getting to see it makes sense. Like, I had several questions that came up. Like, what does it feel like to the patient when they first have that?
So as you saw, the peel actually looks more like a mud mask, and it's actually not very irritating. There are a lot of chemical peels that may sting and burn when you put it on, but for the most part, patients say this is very comfortable. So there's really not a lot involved in that. You do have to leave it on for potentially 6 to 8 hours. So your provider will kind of review with you. It depends on your pigmentation, your skin type, and all of those things, and they'll tell you exactly how long to leave it on for. So I do often encourage patients to schedule their appointment earlier in the day, so they're not, having to like wake up in the middle of the night to wash off the peel.
And then how do you take care of the skin after you take that mask off?
So after the prescribed period, you're supposed to have it on. You just use a gentle cleanser to remove it. I would avoid anything that has like acids or like exfoliating components to it as your cleanser. So easy things, even over the counter, or like CeraVe, Cetaphil cleansers that you can use. And then afterwards, you can go into using the Melon Recovery Balm to moisturize, or you can use other, over-the-counter moisturizers as well. And then in 48 hours, you start using the Cosmelan 2. So with the Cosmelan 2, you really don't need a lot. A little bit goes a long way. And then just a piece.
So how long would this last?
If you use it judiciously, you can use it it can last up to a few months. So really like a pea-sized amount should cover the full face, but you can also just spot treat as well.
And any other additional instructions, like what you need to do to your face?
So, I would just say prior to the treatment, you should avoid things with acids like glycolic acids, salicylic acids, maybe your retinol or retinoid for about a week or before, to make sure your skin's not irritated coming into the peel. And then afterwards, sunscreen is super important, even when you're not going outside. If you're just staying indoors, you definitely want to wear your sunscreen.
Is that because you just don't want to reverse all the good of this peel? And
exactly. You don't want to reverse the benefits you have, or potentially even make things worse, because the skin is a little bit more exposed at that point and a little bit more sensitive.
So, like downtime.
So downtime wise, after the peel, some people can swell a little bit afterwards, and that's not an abnormal or bad side effect. It just varies from person to person. Everyone turns a little pink, and then starting the next day or two, you start peeling. It starts around the mouth, and it kind of moves outwards from there. And the peeling can vary. Some people just have a little bit of flaking, and other people can have more like sheet-like peeling of their skin. But that can last 1 to 2 weeks for most people.
What do you tell people? Can they apply makeup to disguise the pink? Or?
So if you can avoid makeup, that would be better. But if you have to, you can do a little bit of like a BB cream, a CC cream or something. But I will say it's kind of hard to cover because your skin is peeling off, and sometimes the makeup can make it look even worse, to be honest.
Yeah.
So,
and then how long will it take before I can kind of enjoy the benefits? When will the results begin to show?
So once you're done peeling, you'll actually see the difference immediately.
Wow.
And then what we also can do is about 3 to 4 weeks after the initial application, we save a little bit to do a little touch-up of areas that are a little bit more persistent or difficult to treat.
And like once I get those results, will they last? Is this like they're going to last a year? They're going to last 6 months?
So it varies. 1, depending on your condition that we're treating, and 2, lifestyle factors. So if you're really diligent yourself about avoiding the sun, wearing your sunscreen, and your skincare in general, then the results will last a little bit longer. I think also it depends on how much maybe sun damage you had going into it, because a lot of the sun damage is already underlying the skin, and that can continue to appear later on, so that can play a factor into it. But I would say for most people, it can last 6 months to a year, again, taking into account what you're doing at home also.
Okay. We've got a few questions that some of our viewers are asking us, so let me jump right in. One of the viewers is asking, is the chemical peel, is it uncomfortable at any point? Would you describe it?
So afterwards, it can be a little bit uncomfortable. Like I mentioned, the application process isn't too bad, but some like burning, redness, itching, and tightness of the skin is completely normal. But is this like, why would I come to Refine MD to do this peel? Because this is a medical grade chemical peel that does require us to evaluate your skin, make sure we're treating appropriate conditions with it, as well as any follow-up for potential like adverse effects or side effects that can occur with it.
So, like, a viewer is asking, like, what's the magic? She's saying, like, what's really
so
happening
special?
under the skin? Like,
So the thing with this peel is that there's two components to it. The peel itself removes any pigmentation that we already have on the skin. And then the continued skincare with the Cosmelan 2 actually inhibits the synthesis of melanin, which is what creates pigment in the skin. And that's why you continue to see the benefit from it. But that's also why home skincare and routine is so important also.
Somebody's asking about laser treatments in conjunction with this. They say they've had laser treatments before by you at Refined MD, and they want to do. Does this pair with laser treatments, or are they two separate animals?
So they're different in treatments, but you can definitely do things in conjunction with it because the lasers can address different issues that this peel won't address. Because if you're worried about wrinkles, fine lines, collagen building, then that would be more something that you would do with the laser rather than with the Cosmelan Peel. Yeah.
So it sounds like there's a little bit of healing involved, and so some viewers asking me any special additional tips you would give your viewers
I think
besides what we've talked about.
I think mostly that to moisturization is going to be really important after the peel. I think that's the main concern people have is that their skin just feels dry and tight afterwards. But that's what, and most importantly, like I mentioned before, is do not pick the skin, because if you pick the skin off before it's ready to peel off, it will leave more pigmentation behind, which kind of defeats the purpose of everything we're doing anyway.
I hate to double back, but I think you answered this question before, but since the viewer is asking, let's just include it. She wants to know if it's safe to have it during pregnancy, this peel.
So this peel is not safe during pregnancy, mostly because these things aren't like studied in pregnant women. This actual peel does contain some hydroquinone in it also, which isn't deemed to be safe during pregnancy.
Got it. Well, thank you for sharing all the details.
No
It was
problem.
wonderful meeting with you today and learning more about Cosmelan.
It's my pleasure. Thanks for joining.
Thank you. So if you're interested in a Cosmelan Peel, I suggest you book a consultation with Dr. Ye, because this is a medical grade peel, as she explained, that we like to speak to people first and make sure they're an appropriate candidate. We do have a special through the end of January on this peel. The value of this package is $1,700. It comprises of the peel itself, as well as a clear and brilliant laser treatment for follow-up treatment kind of down the line, months after your original Cosmelan Peel. The laser treatment is generally $500. The Cosmelan Peel itself is $1,200. With the special package, both the laser and the peel itself are just $1,200. So for $1,200, you're getting a $1,700 value package. I hope you have a chance to take advantage of it. Winter is a great time to do it. And purchase online, please. You can purchase this online on our store. Go to Refined MD, the shop tab, and you'll find it there. Thank you.